Hi, I'm Isabel Galichia,
And I'm Dr. Jody Galichia.
and in today's video, we're going to be talking about mitral regurgitation.
Mitral regurgitation occurs when one of the most important valves in your heart begins to leak. And what happens is the blood that is pumped out of the heart, instead of going throughout your body, part of it goes back into the chamber it came from. That is mitral regurgitation. And it occurs rather frequently. It occurs as one gets older, sometimes due to heart disease, previous heart attacks, and sometimes it occurs on its own. If there was an infection in the valve, if the mitral valve was, when you were born, was not correctly, the anatomy was not correct. So there are a lot of things, including infections of the valve, that can cause this valve to leak. Now, the question you might ask is, what are the symptoms? So, what do you have that tells you that your valve is leaking? Well, the most important thing is shortness of breath, inability to exercise, sometimes chest pain as well. But mostly you lose your ability to exercise properly. Then, how do you make the diagnosis? Well, simply a stethoscope to the chest can often tell the doctor that this valve is leaking, or give you a very good idea. But even better is an echocardiogram. So if you do an echo on the chest, you can almost always see how severe it is. You can see what's causing this abnormality of the mitral valve, and then you can proceed to either correct the valve surgically or treat with medication, including diuretics and sometimes digitalis and drugs like this, to help the heart beat better, to compensate for this leakage, and also to eliminate some of the excess fluid that you may retain because of this leaky valve. This is a problem that can be dealt with. And here's an interesting thing. It used to be that the only way that you could really ultimately fix this valve was by opening up the chest and doing surgery. Now we have some new methods whereby you can go in through one of the veins or arteries in the groin area and fix this valve without the open heart surgery. So that is something that is getting better as we progress, that technique, but it provides a lot of hope for the future. No surgery and repairing the mitral valve this way. I think it's a very exciting possibility.
Thank you, doctor. So, if I had a loved one who was recently diagnosed with mitral valve regurgitation, what would be some of the questions you would recommend to ask their doctor?
Well, one thing is, what's causing it? Was it something I was born with? Was it an infection? Is it likely to get worse? Because some people have stable mitral regurgitation for a long time, maybe for a lifetime, but not commonly. Usually it does get worse over time. And you can monitor it also with the stethoscope and with echocardiography. It's a great, non-invasive way to see how bad this problem is. Now, if it gets to the point where we're seeing signs of worsening, then a heart catheterization and probably valvular replacement would be the key. You could turn this around with a new mitral valve. And here's a good thing. Now we can often do the replacement of the valve without opening up the chest. We can simply go through the groin area and put a new valve in. That is, in my opinion, the future of treating mitral valve insufficiency.
Thanks for that overview, doctor, and thank you for watching this video. Be sure to visit hearthealthcommunity.com to learn more about mitral valve regurgitation.